time to attend this faculty lectureship this afternoon. We have a distinguished presenter. Before that, I want to give out some thanks to the arrangements today. The faculty lectureship committee reviews all the proposals and makes the choices for us. And I want to thank them for this choice today. Dr. Del Porto, Dr. Chelsea Starr, Dr. Manny Varela, Dr. Michael Zhang, and Dr. Kathleen Wagner. In addition, this takes more than just me standing up here and doing things. I have a lot of help. A lot of the help comes from Communicative Services, John Hauser and Adam Aragon. For the food, Melissa Gross and Maddie basically team up to keep me out of it, so that makes sure that it's good. I thank them for all of that. This will be available on the web when we film it and edit it, but I appreciate you taking time yourself to come today. Dr. Kristin Kuhlmann is one of ours from 2017 when she came to start and lead the nursing program. She earned her Ph.D. at the University of New Mexico and basically has been an active member of the academic community since her arrival. Now, the topic today doesn't need much introduction. So when she provided this synopsis, we were all very intrigued. Who could forget from March 2020 to fall 2021 when our campus was closed to all students and employees due to COVID-19, the pandemic, except those deemed essential to the function of the campus. Due to indications that the U.S. residents indirect mental and physical effects caused by the pandemic, Dr. Kuhlmann provided a survey in the measuring perceived wellness that she conducted with employees at Eastern 2 times upon their return to campus fall 2021 and 7 months later, spring 2022. This afternoon, we're going to be able to listen to her results, her interpretations, her discussion of methodologies, data collection analysis, and there will be lots of time for discussion because I'm sure we're going to have some discussion items. So please help me welcome Dr. Kristin Kuhlmann.
Thank you all for coming and fighting the weather. It's for those who are here, you know, it's 40 mile per hour wind gales with rain and 50 degrees. In other words, you know, February weather in Portales. So thank you for bringing that. There's excellent food here too, so that might have helped somewhat. And some of you may have taken the survey, so we'll get to see how those results came out. So as Dr. Montgomery said, I am Dr. Kristin Kuhlmann. I'm the director of the nursing program and associate professor. It's got tenure this past fall, so I'm excited about that. It's actually my 14th year. I worked here 7 years as a nurse practitioner over in Health Services. I'm a family nurse practitioner too. But I don't get to say that anymore because I'm not certified anymore. I'm full-time teaching. But welcome to all of you. Should have checked this once we got it. There we go. Okay, so this is like NPR. Funding for this study was provided through an ENMU Faculty Research and Instructional Development FRID grant in the academic year 2021 and 2022. And because ENMU supports research so well here, I was able to use the full grant money to pay a research assistant. She worked 10 hours a week for 2 semesters. And she actually published a journal article. I haven't published an article on this study yet, but she, when she was in EDF 503 Educational Psychology, Dr. Shaughnessy and I, well, he more than me, encouraged her to do her literature review on perceived wellness. And she actually wrote this article, got published while we were doing the study. So if you're interested in this, she did a wonderful literature review. And of course, she said there's a need for research, so that worked out well too. So just a reminder of where we were when we came back in fall of 2021. This is 25,000, the highest peaks there. So when we went from, first we had alpha, right? And then we had beta, and then we had delta, and that was a bad one, we thought. And so we left in March of 2020, and except for essential workers, and then all of us, we thought, see that little saddle there in the middle? That was when Delta left, and guess what came? Omicron. Remember that vicious one? And so we came about the time where there's that saddle, and we thought it's safe to come back to work, because we really were seeing the cases and deaths go down. This is deaths on this side. And then we got Omicron. And then about the time, fortunately, I did the second study, we were back into another trough. Thank God. Omicron left, and it's sort of been petering it out ever since. Omicron isn't even, I just was reading, Omicron's not even in the picture anymore. It's gone. Now we have 3 or 4 other strains. So if you're interested in, as a nurse, if you're interested in vaccination, you need to get a new one, because the old ones aren't working for you. So the background was when I thought about what study to do, it was an excellent opportunity because so many of us had been gone, for that year and a half, and a lot had happened in our lives. And so I went and looked at what were some of the psychosocial effects of COVID-19 for people who had to teach their children at home, had to work from home, maybe couldn't work, maybe had a sick loved one, maybe had someone die that they knew. So it was a really stressful time. So the American Psychological Association started doing studies specifically on this. And in fall 2022, 78% of American adults that they surveyed said they had at least one adverse emotional, physical, or mental effect from COVID. By spring of 2021, when we, thought it was going pretty well again, and then we got another big rise in cases, 47% were still reporting the negative emotional, mental, physical health effects. And then in 2023, American Psychological Association is still checking, and long-term stress from COVID-19 is still having mental and physical health effects, with 45 to 58% of those they surveyed reporting chronic conditions or mental health concerns. And the interesting, or sort of not interesting, but sad part of this is it's in younger 18 to 44-year-olds who are reporting this the most. Some of the studies we saw that did studies on people, they determined, Zacher and Randolph determined that the pandemic was associated with a significant decrease in subjective well-being between December and March of 2020. And Covington, who is my research assistant, she reported an increase in stress levels and decrease in perceived wellness due to COVID-19. A household pulse survey that's being done by the National Center for Health Statistics, they weekly run a survey, and they say that U.S. adults' self-reported indicators for anxiety and or depression averages 29 to 35% in 2023. In 2019, before COVID started, that was at 10 to 8%. So we are still seeing, 3 times rate of mental, at least in this study, stress-related mental health effects. So what was the purpose of the study? As Dr. Montgomery said, in March 2020, the public Southwest U.S. University campus, who we know now as us, was closed, and all academic and employee activities were conducted remotely through virtual technology. And for most of us, we did not come back till fall 2021, when the campus reopened to students and most employees. Only those who were considered essential were here during that period of time. So this study was designed to measure change in perceived wellness in employees of the university in fall 2021, and then again in spring 2022 to see if there was a difference, an improvement, hopefully, in their perceived wellness. And then also, would the perceived wellness level, as I said, improve if the risk, had decreased? And we also looked at some independent variables that might predict the change of the score changing between T1 and T2. So our survey instrument was 50 items, 4 demographic, age range, gender, race, and ethnicity. The length of time as an ENMU employee. 3 items had to do with return to work. Do you work from home currently? Work from home anytime between the spring and fall of 21. When you return to work, some people from never having worked from home to still working from home. Household composition, remember, the risk they thought was higher for, babies, young children, and certainly older adults. So we're asking, do you live alone? Do you live with a spouse? Are you married with children? Is it intergenerational family? To your knowledge, have you had COVID? And have you had vaccine? And these 2 that I highlighted are the ones that came out with significant correlations. How worried are you about getting COVID-19? And that was a great deal, somewhat little, or not worried at all. And then another one we asked was how many employees work within your designated workspace office during your work shift, thinking that would put stress on you if you worked with a lot of people. And so, we have a private office, 2 people, 3 to 4, 5 or more. You're working from home or you work outdoors most of the time. And then the other significant correlation was, do you feel that proper social distancing, hand hygiene, and mask wearing are enforced in your work area? The mitigation strategies that we were all told about during that time, yes or no, and other. And then how often are you in a small to moderately sized room of 15 or more people, thinking about teachers, thinking about people who are in, with a lot of people that would increase your stress, certainly. And then we asked them how frequently on that. So those were the questions that we added to the perceived wellness survey. Probably can't see this from far distance, but no, there's 36 items, 6 subscales with 6 items in each subscale. And the subscales are psychological, social, physical, spiritual, intellectual, and emotional. This study has been viewed numerous times with thousands of people since 1997, and including employee groups. And so we were really happy to see something that had such a strong history working well and actually measuring what we think it should measure perceived wellness. If you can see it, there are positive and negative things. And so the asterisk ones are, the negatives, and then the other ones are put in a positive way. For instance, in psychological sense, optimistic about future is a positive, right? And then I can rarely count on good things would be a negative. So they might strongly agree with, I can rarely count on good things, but then we had to reflect that when we got the results to say, strongly disagree with that, because they're saying it's sort of a negative thing psychologically for them. So that was part of and we got instructions on how to do that. When we did the Chromax Alpha of the perceived wellness survey, at T1 it was 0.90, and at T2 it was 0.89, and those indicate high internal consistency reliability of the survey at both administrations. So it was showing that for what we were trying to measure perceived wellness, it was doing a good job. So that was encouraging. So to go over some of our results, the university under study, again, which is us, at that time had 563 full and part-time employees, non-student employees. And in fall 2021, 196 or 34.8% of the employees completed the survey, which is pretty good. And it was a convenience sample. I sent out an email to all employees to participate. Thanks to Dr. Caldwell, that got to go out. And then in spring 2022, when the survey was repeated, 89 employees, or 45.4% of the original cohort, took the survey again. It made me sad. An additional 64 participants took the survey, and they said, I didn't take it the first time. So we had to leave them out of this MAP study. However, at the end, I'm going to show you how I can use them. So I'm excited because you need to go, good data to go to waste. As an incentive, 3 participants from each survey time were randomly selected to receive $20 as a thank you for taking the survey. We call that nominal, but for some of our employees, that was a nice little gifty. So when we're looking at gender from T1 to T2, there wasn't a major difference in gender composition from T1 to T2. However, employed women responded to the survey at a higher percentage than their representation at the university, where men make up 47.5% of employees. So, we have 36% men. So we need more men to take the survey. We wanted it to be equal to university. University-wide for ethnicity and age. There was a shift in age range with fewer 18 to 44-year-olds repeating the survey, and a larger proportion of participants being 45 or older. And this might have been because people who are older were more concerned, and so they sort of stuck with taking the survey again. It went from 52% at T1 to 73% of the sample at T2. So, and I didn't look at what the age range is here at the university. I would suspect we're a little bit on the, our mean is a little bit to the older side. Ethnicity and race. And I took these definitions of the different races from the census because, people argue, well, you should say it this way and you should say it that way. So I went look at the census. These are the terms they use. Not that they're wonderful, but at least it's sort of consistent. So university-wide, again, employees' ethnicity is 20% Hispanic, 80% non-Hispanic, with racial composition for university employees include 1% American Indian Alaskan Native, 4% Asian Pacific Islander, and 3% Black African American. So you can see sort of how that was represented here. There was no difference in Hispanic and non-Hispanic ethnicity between T1 and T2 respondents. There was an increase in the proportion of white Caucasian participants from 79 to 86%, and there were fewer Black African American participants at T2, with no Asian Pacific Islanders at the Asian American Pacific Islanders at the second administration, and our American Indian Alaska Native, we lost them too in the second. We have such small percentages, it's we're trying to capture. So what this shows you is correlations of variables at T1. And so what we did was we looked at those independent variables I talked about: age, gender, race, ethnicity, when you return to work, household composition, if you had contracted COVID-19, if you were vaccinated for COVID-19, your level of worry about contracting COVID-19, number of employees, students in your designated workspace, mitigation strategies, the mask, social distancing and hand hygiene, and frequency of being in a small, moderately sized room with 15 or more people, and how those correlated those risks with your perceived wellness. And at both T1 and T2, only 2 of the independent variables correlated significantly with each other and the perceived wellness survey subscales. That was the level of worry about contracting COVID-19 and enforcement of mitigation strategies in the workplace. For this study, what we used for correlation coefficient values was describing it as small when the value is below 0.30, moderate if it's between 0.30 and 0.49, and strong with the correlation coefficient is 0.5 or higher. So when I talk about that, sort of telling you what range I'm talking about. And so you can see that all the perceived wellness subscales correlated very well with each other. And then got moderate between worried and mitigation strategies. That was a moderate correlation. And then we had mostly moderate, but there were some small and moderate correlations there. And then on the second time we gave it, again, we got pretty consistent correlation of the subscales of the perceived wellness instrument, and mitigation strategies of being worried about getting COVID. But we did not get significant results for emotional wellness with mitigation factors or worry. And we can only look at sort of what was happening at the time. The other thing was that the mitigation strategies had flipped from positive, like so if you had good mitigation strategies, then you had a higher perceived wellness. And when we did it at T2, it actually reversed, saying, that their wellness was less if there were mitigation strategies. You remember what was happening about that time in April when we did the second survey. That was shortly after the governor had removed the mandate for masks and social distancing for the schools or from workplaces for state employees. And we got 8 responses, or basically did not respond. And I got, they just refused to, or did not answer that question. I shouldn't say refused, that's put my values on it. But they did not answer that question. And then there were several comments about, you need to take this question off of this survey because it's no longer anything to think about, which was interesting. So we don't know if that's sort of what flipped it and, made it no longer statistically significant, but interesting. Then we looked at those 2 independent variables, and on the survey at T2, I had to talk about that. So the mitigation strategies, which we talked about, there was a small positive total mean score correlating with the perceived wellness scale, and then medium negative, as I was talking about, that flipped. And it actually was stronger correlation in T2. And then worry, how worried are you about getting COVID-19? That stayed moderately negative with the Portales total mean score correlation with worry, and stayed negative. So in other words, if you were worried, your perceived wellness score was lower too. And this was the one thing we got a significant improvement in. There was a significant decrease in worry about getting COVID-19. So they felt more comfortable, and not as worried about. Their perceived wellness was increased. So here are the perceived wellness survey subscales. And overall, they did go up in T2, so people are feeling a little bit better, perceived wellness-wise. The physical changed a little bit, and actually it was higher, or higher in T1 than T2, time 1 and time 2. There was a change in the mean of the subscales, meaning that the perceived wellness went up, but it was not significant. And I wonder if Omicron had something to do with that, because we saw that big rise again. So then we also did a multiple regression, and we was to analyze the relationship between the level of perceived wellness, mean of the subscales, with the independent variables of worry and the mitigation strategies. And it explained about 16% of perceived wellness score at T1 and 20% at T2. So it wasn't great predicting, but it definitely, those 2 things had an influence on people's perceived wellness score. So that was good. We saw some kind of relationship there. So this is what I told you about the matched and unmatched participants. We went ahead and checked to see if we had included those 64 participants that we couldn't because they weren't matched, would there have been a significant difference in the perceived wellness score? And no, there wasn't. So that's good to know. So, discussion. So, found out U.S. adults are still experiencing anxiety and depression post-COVID-19 compared to before the pandemic. When employees perceive a workplace health risk such as contracting COVID-19, it is important that employers provide clear prevention and mitigation strategies to optimize employee wellness, provide access to preventive treatment services to support employee physical and mental health, because we know people are still having difficulties. And when I looked at multiple studies have found that supportive employee wellness programs increase employee engagement, improvement in health, and work productivity. So plan-related study, I'm going to use that T2 group, is because we're seeing that people are still struggling with especially anxiety, depression, and just wellness in general, according to the American Psychological Association. I want to do another study in using the perceived wellness scale survey again in fall 2024 and see how those compare at 3 different times, and if we are getting an improvement in perceived wellness, and if in fact scores for the subscales for these 6 different areas of wellness are staying the same, going up. Maybe instead of having COVID-19 questions, of course, since that's not our main, that's not what people are really focused on now, is talk about anxiety, talk about worry, talk about, some of the symptoms of long-term stress. So that will be a planned study for next fall. So I hope you guys will, if you get the email, think about taking that one. Thank you. I'll take any questions. Anybody? Yes, right there.
I think I might have missed it, but can you tell us how many cases and how many, what numbers were, that you had in terms of morbidity for your population?
All right, we didn't do any actual, I could look up when we did the study about, I think it was about, I'd have to look it up, I think about 20% said they'd had COVID, and about, by the second time, I'll look it up and then give you the exact, numbers. I think about 40% said they were vaccinated. So we were starting to see that people were, protecting themselves with whatever strategies they could use at the time, because we're still pretty thick in COVID right now. Anybody else? I'll get you those numbers. Answer all your questions, or?
I have one. Yeah, you said you're going to follow it up with another study in 2024. Are you going to adjust any of your questions?
Yes.
How? I'm just interested in what you're going to do.
I'm going to take out the COVID-19 specific questions and look for some, keep the perceived wellness scale, because that's going to be, fine, so that we can use the means from the other times we've measured it. But have more specific questions about long-term stress, some of the symptoms of stress, anxiety, depression symptoms, that kind of thing, and see how that lines up with, because I don't think people, even if we're seeing that 3 times as many people are having depression, anxiety right now, I don't think we can say, oh, it's COVID-19, it's still COVID-19, but there's something, still going on that people are feeling very vulnerable. Because this is perceived wellness, it's like, it doesn't matter, we probably heard of worried well people, and then people who are very ill physically but consider themselves healthy, their perceived wellness is good, where somebody who is very healthy, their perceived wellness might not, might be lower. So it's all about that person's subjective feelings about how they're doing with their, those 6 areas of wellness.
Do you think that because we're in Portales, it might be different if you did this in Dallas or somewhere else in a highly urban environment? And are there other studies that looked at that kind of perceived wellness in a different, because our sample is going to be a little bit different.
Right, and the study that Molly Huntington did was, she tried to find studies that talked about, use this scale or that had wellness as, what they were studying and measuring, with COVID-19. And so I would suspect that the literature review, doing it again, would be on perceived wellness and long-term stress, rather than COVID-19 specifically. So we'll need more literature review to find out what those variables would be in those questions. Yes.
When you do your next follow-up study, are you concerned that now there's going to be a retrospective perception of perceived wellness that's been distorted by media and extraneous elements that affected people's response to COVID that had really nothing to do with their perceived wellness?
The point is that it had nothing to do with their wellness, but I think it had a lot to do with their perceived wellness.
I think
Exactly. So that's why it's also, it's a subjective feeling. It's not, we didn't ask them how many, how many pills, prescriptions do you have? Do you have any, medical or mental health, diseases? We didn't ask any of that. It's all about, and if you look at these questions, and I think that would help if you could, see them, that sort of helps you. You're like, that really measures psychological wellness, but it's been, this scale. And the other thing I like about it is she took her name off of it. When I first looked at it, it had the person's name who had come up with it in 1996. And then she's now just the perceived wellness scale, and it's open to anybody who wants to use it. And it's free, and she tells you how to score it and everything. I know it's a she because originally, she had her little bio on there. She's a psychologist, so I think it seems to do a really good job to measure perceived wellness. So, and I didn't say also, like, when you answer the questions, they're not like, okay, all the psychological questions are here, all the, they're all spread out through those 36 items. And so you're not even sure when you're saying, I feel my life is always worthwhile, what subscale that belonged in, or, how that shows your perceived wellness for that, whatever subscale that falls in. So it was sort of interesting. Yes.
Do you identify any policy implications in this line of research?
I definitely do for wellness, and I presented preliminary findings at Sigma, and the question I got was, when you did the mitigation strategies and all that at the university, did they have anything supporting mental health, or people coming back and being stressed about it? And I'm like, not that I know. I mean, not any more than we usually have. It really wasn't brought to the forefront. Oh, come back. We know you're stressed out, about this. It's sort of scary, since we've all been at home and they told us to stay away from people, and now we're going to have you come back. So that was something that really played out to me, occupational health. That it would have been really, and I'm sure a lot of, I'm not blaming the employers, and the leaders at P at that time, but it was more, we were focused on the physical. We don't want people getting sick, and if you're sick, stay home, and all that, and keep your social distance, and, keep your hand gel, hand sanitizer. But we weren't really focusing on the stress, long-term stress, and what effect that would have on people, and how they felt before, and how they felt about just their general wellness. So I think that was a point that maybe a lot of employers didn't think about. Yes.
So I'm kind of curious about these test subjects who said they were worthy.
Uh-huh.
And do you see a relationship between this worry and treating the cases? Maybe they worried and did something about it, or maybe they worried and didn't do anything about it and got no cases. In other words, is there a relationship, a correlation between worry and case number?
There was, no, there wasn't any correlation except the perceived wellness scales with worry and mitigation. So they had a positive, if you felt like the mitigation strategies were, well done at the university, then you had a higher wellness and vice versa. If you felt like they weren't following mitigation strategies, you had a lower perceived wellness score. But those were the only, and then the worry had to do with, how worried are you about getting COVID? And it seemed to correlate with, if you're really worried, you have a lower perceived wellness score. If you weren't as worried, you have a higher perceived wellness score.
Yeah, but I'm kind of curious about if you worry a lot, did it translate into lower case numbers, lower numbers of cases? Did the worry allow them to do it and to mitigate the number of cases? Or did they worry for nothing?
Well, I think everybody, I think people had reason to worry, especially since we all went home from, I mean, like it was worrying to come back, and being exposed. So some people weren't worried at all. You would see people who said, I'm not worried, I haven't been vaccinated, I've had COVID, or, I haven't, but family members have, your level of worry is sort of you, it's internal to you, and then what you do about that, But definitely, if there were good mitigation strategies, they felt more well, and they didn't feel as worried. And then if they felt like the mitigation strategies weren't as well done, they were more worried. And then they also had a lower perceived wellness score, mean score, because they were worried about catching. It was specifically about COVID-19. Are you worried about tracking COVID-19? So it was a sort of generalized worry. Yes.
I think we have a lot of personal stories. I can remember the first time getting on an airplane after this and then thinking, who's coughing or anything else like that, or clearing their throat. I mean, everybody has this perception about what they're listening for and reacting to. But it was such an odd feeling that I never had that before in my life.
Yeah, it's, to stay home and isolate. And I remember when I go to the store, I would look at people because it was almost like I catch it if I look at them. It was crazy how you felt like you just had to isolate yourself, so much during that time. We had lockdown, I think that's what we called it. Stay at home, kind of precautions. It was a very stressful time, but it's still going on, for a lot of people. Whether it's totally COVID-19 or just, people now worry about more things or, are stressed about more things, would be sort of interesting to see.
Any other questions?
Let's get this proceeded on this.
If not, let's thank Dr. Kuhlmann one more time. And you can carry on your other discussions with all the food and the drink, coffee, whatever you want. Thank you for coming.
Thank you for coming.